Hello, hello. My name is Aura, and I'm here to do the newborn assessment. First, I'm going to be introducing myself, coming into the room, and then introducing myself using the age-appropriate language to both the parents and, of course, the baby. First, I'll be checking for safety around the baby, making sure that the baby is safe and well positioned in the crib. If not, it is my duty as a nurse to educate, and also I'll be giving the baby privacy, and also I'll go ahead and check the handband of the baby to make sure that the name and date of birth tallies with that of the mom. Okay, and then I'll be asking questions of the history, the birth history of the baby, whether it's through vaginal birth or through cesarean section. And also I'll be doing the temperature, the pulse, and the respiration rate. So with the temperature, I'll be using the axillary route, and also to get the pulse rate, I'll be using the apical, using my stethoscope to listen to the apical for 1 full minute, and then for respiration, I'll gently put my hands on the baby. When the chest rises and fall, I'll count for 1 full minute to get the respiratory rate. And then I will be looking out for the general appearance of the baby. If the baby is lethargic, if the baby is crying or at rest, I'll be checking the height of the baby. I'll be checking the weight of the baby. I'll be checking for the head circumference. I'll be checking for the chest circumference of the baby. And then when I'm done with all of that, I will go ahead to do the head to toe assessment. So but before that, also I will check for the skin. I'll be looking out for the vernix, which is the whitish substance that protects the skin of the baby when the baby is newly born. And then I'll be checking for milia, which is the whitish substance around like spots around the face of the baby. And then I'll be checking for lanugo, which is the fine hairs around the shoulder of the baby and the back of the baby. And then I will be checking for Mongolia spots, which is often known as the birth marks. I'll be checking if there are any traumas that the baby experienced through birth also. And I'll be checking for erythemias, which is the like red rashes around the face of the baby or the skin of the baby. So I'll go ahead and start with the head. I'll be checking the fontanelle, and which is called the anterior fontanelle, and the posterior fontanelle, to check if there is any abnormalities. And then I check the head of the baby to see it's round and phasallic. Also, I will be checking the ears to make sure it's symmetric and well aligned. I'm looking at the face of the baby also to see that it's well aligned. And then I'm looking for the eyes to check for the eye color, the iris. Also I check for conjunctiva. I check for strabismus, lazy eyes. And then looking at the nose also I check for patency of the nose. And then I'll be looking at the mouth. We're using my gloves to check the soft palate and the hard palate to check if there are any abnormalities. And also I will move to the chest Of course, the chest circumference is already checked. I will be checking, listening for murmurs. I'll be checking for apical pulse, and checking for the apical rate also. And I will be checking the abdomen. I'll be auscultating and listening for bowel sounds if the baby has had its first meal. I'll be checking for the voiding pattern of the baby. If the baby has had its first stool, which is usually black and tarry, it's called the meconium. And also I'll be checking if the baby is a female, a girl. I'll be looking out for the labia minora and labia majora, making sure that the labia covers the clitoris. And for the boy child, I'll be checking for the testes, the rugae, making sure it's falling and well aligned, and the voiding pattern also. And be checking for the fingers, counting the fingers, making sure everything is equal, and the range of motion is equal bilaterally. I'm checking the toes, making sure it's also equal, and then checking Babinski reflex, using the thumb of my finger to massage the feet towards the toes, and if it flares, meaning the Babinski reflex is present. And then also I'll be facing my baby downwards to check the spine, checking for any abnormalities, and then checking for the anus, and using my fingers to check if the muscles are intact. If it contracts, meaning it's intact. And also I'll be checking for the general behavior of this baby, if the baby is deep asleep, if it's light asleep, if it's active, if it's crying or lethargic. And also I'll be checking for dislocation, and checking using lifting the baby's feet towards the abdomen, and if I hear any clicks, meaning the baby has had a form of dislocation and will be sent for further investigation. I would also check